Good afternoon, everyone. My name is Janine Payne, and I am a co-director of the Institute for the Advancement of Women's Health. Thank you for attending today's Lunch and Learn. For many of you, this information is not brand new, but for those that may be new to us, the Institute for the Advancement of Women's Health, or IAWH, is a community-based nonprofit 501c3 organization that's founded in Prince William County, Virginia. Our mission is to broaden the understanding of women's health, including, but also beyond reproductive and sexual health, raising awareness and increasing knowledge about what it really means to address women as a whole person, considering her sociology and the many social determinants that can impact health and wellness. We develop and deliver programs that covers life's evolution, from menses to menopause and everything in between and after, chronic conditions like hypertension control, breast and cervical cancer, caregiving, and obviously so much more. Today's Lunch and Learn will cover a wide range of chronic conditions, many of which co-occur and can be fatal. But together, we will learn that these conditions can be managed. Today's presenter, Rick Ricciardi, is a former colleague and a friend who will lead our discussion. We're so glad to have you here, Rick. We want this session to be interactive. So here's what we ask. If you have questions or need further explanation, use the chat to express yourself. Also, during the Q&A, open your mic to be heard so that you walk away today more informed and empowered to take charge of your health. Next up is Isabella Long, a first-year public health scholar at American University, and that's located in Washington, D.C., and is working with us, IAWH, this fall semester. She will introduce our presenter today. Isabella?
Hi, everyone. Dr. Rick Ricciardi is a professor at the School of Nursing at George Washington University and executive director for the Center for Health Policy and Media Engagement. Dr. Ricciardi has years of experience working with underserved populations and currently works at Mercy Health Clinic, a clinic that supports the health education and well-being of low-income, uninsured patients. Dr. Ricciardi works to ensure that income is never a barrier to health and to provide as many people as possible with the tools and knowledge necessary to become their own health advocates. Today, Dr. Ricciardi will share tips and advice on how to manage the most common chronic conditions and explain what it means to have them. He will also go over preventative measures and things you can do today to feel better tomorrow. Please welcome Dr. Rick Ricciardi.
Thank you so much, Isabella. I'm really, really excited to be here and to be part of this program. And thank you also to Janine, my good friend who I love so much, and Cheryl. We had the chance, Janine and I have had the chance to work together and to get to know each other. So it's always good to see you. And I'm excited by everyone's presence here today and to learn together. As we all do every day, we all learn something new about ourselves, about others, about the world, and to help us to take that learning to make us healthier, stronger, maybe wiser, and better people to be around for other people. So let's start the journey. I do have a presentation with some notes to get us rolling here. Can you all see that? Okay, great. And my audio is good? You all can hear me okay? Good. Yeah. So as Janine said, please interrupt me at any time. I will not consider it interruption. For questions, comments, anything that you think that others might want to hear, share stories, what might add. So I'm Rick Ricciardi, and I'm a professor at George Washington University, and I'm excited to be here at GW. I'm actually in the office right now, and to be a nurse. I love being a nurse. I've been a nurse practitioner for 40 years, and it's a great profession. So those of you who are perhaps interested in healthcare, nursing is great, or if you have family members, brothers, sisters, children, grandchildren, whatever, cousins, I would not hesitate to share with them the wonder of nursing and what we do as nurses. So we're on a road here to talk about chronic disease. And what is, chronic diseases? And well, just by the word chronic, a chronic disease is some disease or pathology or something that can cause damage to you that doesn't go away without intervention, or perhaps even with intervention, you have to live with it forever. A great example of that is HIV, right? In the early days, and I hear this from young people all the time, the early days, HIV, people died from it, right? They had AIDS, we had no medication, there was nothing. But now we have great medications that can control the virus, and many people could go on and live healthy lives, and will not die from their HIV. And I have some of young people that tell me, well, HIV is curable. No, it's not curable. It's a chronic disease. It's still there. It's still with you. It doesn't go away, but it's managed. It's under control now with the new medications we have. So chronic typically means it will never go away in you. Now, we'll talk about some caveats in that. So 6 in 10 of us adults in the US have at least one chronic disease. Many of us have more than one. 4 in 10, 40% of the population have 2 or more, or sometimes referred to as multiple chronic conditions, more than one chronic disease. And what are they? One, and the most common one, is heart disease. And heart disease means a number of different things. It means that your heart is not pumping efficiently, so that the blood supply and oxygen isn't getting efficiently provided to the brain, organs, etc., and that can cause damage. But heart disease also comes in the form of the arteries that are in your body that take the blood away from your heart and deliver it to the cells, especially the muscles, so we can get up and walk around and do the kind of things we like to do. Those muscles need energy, they need oxygen. So they need glucose and they need oxygen, because we're considered to be aerobic organisms, meaning we need oxygen to survive. We take oxygen and we break it down into chemical energy, and that chemical energy gets us going. So heart disease can occur at the blood vessel level, meaning that your blood vessels get clogged, or they are working inefficiently. So it's not the heart that might be a problem. It might actually be the blood vessel. And the blood vessel is not allowing the heart to push enough blood into certain areas of the body. And when that happens in the brain, that's often referred to as a stroke. If your brain does not get enough oxygen, you will pass out. And in passing out, we hope that your body would help to regenerate itself or remove what might be in the way of giving that blood to your brain, or allow that blood vessel to open up, and then that your brain will then get blood, which carries oxygen and energy, glucose, and then you would wake up because your brain is getting oxygenated. So heart disease and stroke are related, right? They're related. It could be a clot that comes from your leg that goes to your lungs, or it could be a clot that comes from your lungs or your neck area in your carotid arteries, and goes up to your brain. And then that clot could get stuck somewhere in a blood vessel in your brain, and that would ultimately cause a stroke. Now, the good news is that over the years, particularly over the last 30 or 40 years, we have many, many, many medications to treat heart disease. And that's the primary reason why the lifespan of Americans has gone up so much since the 1950s. Because in the 1950s, it was not uncommon for someone to die from cardiovascular disease in their 60s and even in their 50s. But now, with the advent of multiple kinds of cardiovascular medications, we can live longer. And if we take our medicines appropriately, we can minimize the amount of damage from the blood vessels or the heart not pumping efficiently to our end organs, to our brain, to our kidneys, to our stomach to digest food, all the areas that are so important to the human body. I hope by the end of today, you really get an understanding of how interconnected all of this is and how miraculous the human body really is. Because think about, we're talking about chronic disease, but think about how many things are actually going right. The complexity of, one, light is coming in through your eyes and you can see what's going on around you. Noise is coming in through your ears and you can actually hear me talk about chronic diseases in America. Touch, you can feel, put your hand on something. The nervous system is taking that touch and transmitting it to chemical energy, bringing it up to your brain, and then you actually feel. This is all happening, and I consider it to be miraculously. So there are many, many, many great things that are going on in your body, and that's what we want to keep happening. We want all these great things to keep moving forward, to give us the opportunities for us to hear, to smell, to taste, to see, to feel, and to think and to love, and to, just be a person. So taking care of your heart is important. And we're going to talk more about how we can do that. And heart disease, like I said, just a refresher, it can be the heart muscle itself that doesn't work well, or it could be the blood vessels that are coming out of your heart that have some issue with them. And that all leads itself to not providing enough oxygen or nutrients to the important organs in your body to let us do the things we like to do. Cancer, which is the next most prevalent chronic disease, and that is really, really complicated. To me, it's much more complicated than the cardiovascular system, because cancer is all evolved around your immune system. And we don't really ever think about our immune system. Now, during COVID, we might, because we talk about vaccinations and how we need to trigger and stimulate our immune system so we can protect ourselves from different viruses and bacteria. But I don't think we often think about how the immune system is protecting us from cancer. Because inside our body, all day long, there's this war going on with our immune system trying to get rid of hazardous materials in our body, cells that are disruptively dividing and trying to take advantage of the blood supply and all the good things in our body. But these types of cells are not aligned with health. They are aligned with just dividing and becoming very out of control. Our immune system keeps those out of control cells in check. So cancer, it happens when we get older more frequently, because as we get older, our immune system starts to deteriorate. unfortunately. But there are ways, and we're going to talk about that, how we can protect that or make it stay as strong as long as possible. And there are many, many forms of cancer. Cancer is an oncologic condition, oncology, but there are so many different kinds of biologic cancer. There's tumors, there's blood cancers, there's different kinds of tumors arising in different parts of your body that act differently, are treated differently, and are controlled differently. So that's why many times when people find out that they have a cancer, you have to wait until you get the pathology report, the report from someone who examines the blood or examines the tumor to decide what kind of cancer is this. And once the pathologist can describe that, we can then decide what kind of treatment is best aligned with that kind of cancer. So cancer is a chronic disease. It's something that you have, but people can be cured. So that may or may not be chronic. You may have leukemia and you get treated for your leukemia and it will never come back. So that's the good news about cancer. We have many treatments. Chronic lung disease is very prevalent in our population. And as you can well aware, it's very much associated with smoking or any kind of damage to the lungs, minors, or working in an environment where an environmental toxin is inhaled that causes damage to your lungs. Chronic lung disease, what happens is that in your lung, in the tissue in your lung, it gets damaged. And in that tissue, it's also a miraculous going on in there, is what happens at the alveolar level, at the level where at the very end of the air tube that's going in from your mouth into your trachea, down into your lungs, down at the very end, there's these little areas where the blood and the air mix. They get together and they share each other's good things and each other's bad things. So they can get excreted through your urine, or if you have a bowel movement, or it could get excreted through your breathing. CO2, for example. Your body likes oxygen and it blows off carbon dioxide. So at that level, you have this exchange of CO2 with oxygen, and then the CO2 gets exhaled and the oxygen goes its way through the blood. And then the blood takes that oxygen to all the cells, and particularly the muscle, to help you do the work you need to do. So when that is damaged, boy, that's a problem, right? Because if your lung is damaged and the blood is there ready to accept the oxygen, but there's damage at the alveolar level, or at the level where this exchange takes place, it doesn't get into your blood. The oxygen doesn't get into your blood. So the blood goes back and it doesn't have as much oxygen in it. And that's not a good thing for muscles. We love oxygen. We like to have oxygen. So chronic lung disease can happen from damage at that level, but it also can happen in the tubes that go down from the oral airway in your trachea, down into the bronchioles, the right and left side. You got two big tubes going into each lung. And for example, when you have bronchospasm or asthma, those tubes can, as they get further down, could start to constrict or spasm. And when they spasm, it reduces the size of the airway. And by reducing the size of the airway, you have air trapped in your lungs. So air doesn't go in and air doesn't get out. And that air that's in your lung that's not going in and out, it's in a dead space and it's not useful. It doesn't do anybody any good just sitting there. In fact, it's bad for you. So chronic lung disease can be treated a number of ways depending on where the disease is. But as you can see, I once had a teacher, and I loved this teacher, and he was a pulmonologist. It was a physician who did internal medicine and then did a fellowship in pulmonary care. So he was an expert in the lung and the heart. And what he said stuck with me. Here I am, a 20-year-old learning about nursing. He said, the most important thing you need to know about the cardiorespiratory system is this, that the air goes in and out and the blood goes round and round. So if any one of those have damage or are not working properly, they're all interconnected. If the air isn't going in and out, well, the blood can be going round and round, but it's not getting what it needs. If the blood isn't going round and round as well as it should be, if you have a cardiac problem, then it doesn't pick up the air as it needs and bring it to the tissues. So you can see how the heart disease, stroke, and lung disease are all connected. And they're all very important parts of treatment. And they're treated differently with different medications. Sometimes one medication may help with both. But combined together, you need to be working. If you do have chronic lung disease, if you do have heart disease, you need to stick on and work on those. Of course, unfortunately, very sadly, even though we are spending billions of dollars in research, we still don't have our arms wrapped around Alzheimer's disease. And many of you, I'm sure, have had family members or have know friends about the challenges with Alzheimer's disease. And it is totally a chronic disease. And it's always scary when you forget something. You're like, oh, I forgot that. Oh, I hope I'm not getting dementia and Alzheimer's disease. We know that we need to come up with better medical treatments for that, and it is a struggle. And much of our government spending on research, we do have a lot that's studying the brain and Alzheimer's disease. And Alzheimer's disease can happen in early onset, people in their 40s and 50s. And more typically, Alzheimer's disease, which is probably a separate kind of Alzheimer's disease, just like there's separate kinds of cancers, can occur, in your 60s, 70s, 80s, etc. Now, diabetes, which is one of the more common problems, it's very much linked to body weight and physical activity. But diabetes happens when, well, there's two types, actually, I should back up. There's two types of diabetes. There's type 1, which occurs when your pancreas stops producing insulin. And that usually happens to individuals from a viral infection or some autoimmune immune sort of breakdown. There's that immune system again that breaks down, and it causes the pancreas to lose or damage the cells in the pancreas that produce insulin. So you're not making any insulin, therefore all of your insulin has to come from an external source. That's type 1 diabetes. And type 2 diabetes, which is much more common and one you're probably more familiar with, is where over time, the insulin that your body produces isn't as effective, and that's not the insulin itself, but it's the cell of getting the glucose into that cell to provide that cell with energy. So what insulin does, it's a hormone or a chemical that floats around in your body that's produced in the pancreas that provides a mechanism to trigger the cells, especially the muscle cells, because they use the most energy to get you to move around, and the brain, to allow the insulin, the glucose, which is the energy source, which is the sugar or the energy source, to get into your cell. So there could be, when you have diabetes, you could have resistance to the insulin working on that cell, or you could have an insufficient supply of insulin. So you could have not enough insulin, or you could have cells that aren't working well to allow that insulin to do its job to get the glucose in the cell. And there's obviously there's medications for that. There's insulin. You can take insulin. So your body can get extra insulin by taking it through a shot or through a pump. Or you can take medications that stimulate the pancreas to provide more insulin, or to help the cells to get better at allowing the insulin to do its job to let the sugar in. Now, why is this important? Because your body likes to maintain a homeostasis or a balance of sugar between 60 and 65 and 100 in the bloodstream. Once you start getting beyond that or below that, the body doesn't like it, and it causes damage to organs, to your arteries, etc. That takes us to chronic kidney disease, which can occur from high blood pressure, which is a heart disease, from diabetes, because glucose is filtered in the kidney, and the kidney is responsible for a lot of things. Most people don't know that the kidney is primarily responsible for controlling your blood pressure. It does a great job of controlling your blood pressure, but it also is a very important organ that cleans out your blood and expels bad things and helps to keep good things like glucose, which is energy. But when the kidney isn't working properly, or if you have high glucose and diabetes, it will excrete. It can't keep up with the amount of glucose in your blood. So therefore, it will excrete glucose in your urine. That's why you have sweet urine, or your urine gets tested for sugars. And when glucose gets excreted through your urine, because of the chemical process of what happens when there's a solute and fluids, it pulls water with it. So you pee a lot more. That's why you heard of one of the signs of diabetes is going to the bathroom or peeing more, or if you're somebody who didn't wake up at night to go to the bathroom and now you're waking up 3 or 4 times a night. Likely, if that's you, then you have diabetes. That would be the number one thing. Someone who comes into my clinic and says, I never used to wake up at night, and now I'm waking up 4 or 5 times a night, and oh, by the way, I'm peeing all day long, and oh, by the way, I just can't drink enough. I'm thirsty. That person has diabetes. You don't even have to test them. You know that they have diabetes. So these are all connected. They're all treated differently, but in some ways, like for example, drugs that you use to control blood pressure, if you have hypertension, they often impact the kidney, and the kidney will then put out different hormones which affect what's called the baroreceptors, these little receptors in your body that tell the nervous system how to control how dilated or constricted your arteries are, which when you constrict something, that increases the pressure, right? If you step on a garden hose, if you're running your garden hose and you step on that garden hose, the pressure from that point before is increasing because it's not running out like it was. It didn't just run out of the hose. You're slowing it down. You're increasing the pressure. And that pressure is backing up the garden hose. So in your body, when the arteries are constricted, that pressure backs up to your heart. And that's not good. When the pressure backs up to your heart, that's when the heart can become damaged. And that's another cause of heart disease. So those are the chronic diseases. Janine, or Isabella, do we have any questions so far? Or should I keep rolling? I'll keep rolling. Please, if you have questions, don't be afraid to put them in the chat box, etc. Okay, so that was a little bit about the chronic illnesses. Now we'll talk a little bit about what can you do to prevent them from happening. One, you all know this, I'm sure, is that you could eliminate or minimize your tobacco use, whether it's smoking or whether it's chewing tobacco. They're both are damaging to the human body. Tobacco that's smoked, it may not be the nicotine itself, but it often could be the products that are the chemicals that are in the cigarette over time will damage the lungs. When you chew tobacco, the chewing and the chemicals in what's called snuff, or what you have in between your gums and your cheek or under your tongue or whatever, over time causes havoc on the cells in your oral cavity. They just go ballistic over that, and then they can turn cancerous. The other thing you can control, hopefully, if you have the means and the access, is to your diet. I mean, we are what we eat. And I guess we can't understate how important it is to eat healthy, to limit the amount of sweets, stay away from sodas, stay away from diet sodas, because we know that, you know, the chemicals in the diet soda are not healthy. So what about good old water? You know, now be cautious with water too. As you know, some areas where water may not be all that healthy. I hate to say that in the United States, but unfortunately, you know your water supply. Make sure you know what you're drinking. But poor nutrition, eating the right kinds of foods, and then eating the right amount of foods. And I know many of my friends that come from Europe and they go to a restaurant in the US, the first thing they say, wow, you guys have some serious portions here in the US. We tend to like big portions. We get into habits, not necessarily because our body is calling for it, listening to our appetite. We just do it because it's a habit. So be cautious of that. Think about how you can increase the amount of fresh fruits and vegetables, and minimize the amount of processed foods that you eat and the quantity of foods. The other thing we can control, which is my area that I do a lot of teaching and engagement with, is how can we increase our physical activity? Being sedentary, many people say us sitting in our chairs and being on computers is the new smoking. That becoming sedentary over long periods of time is incredibly damaging to the human body. We need to get up and move. Remember Michelle Obama, wonderful first lady, right? Let's move. Let's move, let's groove. She had it right. We need to get up out of our chairs and do whatever it is that we're capable of doing. Everyone has different levels of activity that they can participate in. But we all need to be doing something every day, every single day. Okay, this is so important to our health. And then, of course, reducing our alcohol intake. We know that alcohol is a major problem in the US. It's addictive in some people to go on to become alcoholics physiologically, but there's also psychological addictions to alcohol. It is not a terrific substance for the human body. Small quantities of it, are not that troubling, but when it's excessive use, it causes a lot of damage to the human body, the brain, the tissues. It affects the immune system. There goes that immune system again. That's why in individuals you see about breast cancer, alcohol is a risk factor for breast cancer. Why? Because alcohol may affect your immune system, and if your immune system is affected, it may not control that cancer that potentially could start in your breast. There are of course, there are other ways for you to improve your health and reduce the damage from any chronic diseases, is to make sure you get enough sleep. Sleep is another area like the immune system that we don't pay enough attention to. We really do need to let our body become restored, because when we do that, guess what? Our immune system is smiling all day when we get sleep. The immune system loves for you to sleep. It gives it the time to figure out what's going on in your body, to use a lot of the energy that we would be using from walking and doing our chores and working into the immune system at night when we sleep, that it can do its job at night and come alive. And when we don't get enough sleep, we're not charging our immune system, and that's bad for us. So sleep, there's so many reasons why you should not try to cheat yourself of sleep. You know, I had a first sergeant in the Army that used to say all the time with physical activity, we'd be out doing our PT at 5 o'clock in the morning, and he'd say, don't cheat yourself. And I never forgot that. And so don't cheat yourself from sleep. Get yourself rested. Your body will, like I said, be smiling all day long if you get enough sleep. And if you need to take a nap, by all means, take a nap. I'm going to self-disclose here. As I've gotten older, I never took naps when I was younger. I take naps now, and I'm willing to say that in front of you all, just so that I can make the point that taking naps is fine. Let me look in the chat. There's a couple of things here. Question is, are inflammatory diseases related, and can they be treated with fewer medications? Now, the body, that's a great question. Inflammation occurs in the body for a lot of reasons. One, you could, let's say you're starting a new physical activity and you never used these muscles before. By using them, they'll become perhaps a little bit overworked, and they can become inflamed. Inflammation can occur internally from your body not being comfortable with a certain substance, i.e. could be a bacteria, could be a virus, could be some cell. And when your body's trying to get rid of it, it may introduce the inflammatory cascade, and then your body might be, in those parts of your body can become tender, can become red, or can become hot. Like if you have arthritis, rheumatoid arthritis, that's a major inflammatory condition where your joints could actually become hot and red because your immune system is at war in there. And, you know, all this inflammation is going on. So the question was, can you treat, let me go back to it. Can be treated with fewer medications? It depends on what kind of inflammation you have. Some inflammations are very serious, and they can cause you to have neurologic dysfunction and, you know, neurologic degeneration, and they're treated with steroids or different kinds of biologicals that are being produced now, very powerful medications. Fewer medications most of the time is always better, but there may not be that in the cards, depending on you know, how you respond to the medication. Are inflammatory diseases related? Oh, I asked that one already. Why does the medical profession treat obesity like the cause of ailments as opposed to a symptom or unrelated? Well, that's a great question. And obesity is a disease, and in my opinion, and it's a chronic illness, in my opinion. And like other chronic illnesses, when you have that, are struggling with it, it lends itself to it's a risk factor for other ones. For example, obesity is a risk factor for breast cancer. It's a risk factor for many cancers. It's a risk factor for high blood pressure. It's a risk factor for diabetes. So it's a risk factor because, one, we may not know all the cause and effect there. We may not have the cause of why it happens, but we know that it does generate extra work for the body, right? If you carry extra weight on your body, that adds no benefit to your body. It doesn't do anything to provide you with a healthy way forward. That carrying that extra weight just requires your body to use more energy to lug it around. So by lugging it around, you're not using that energy to do something else, like keep yourself healthy. So that's one of the theories of why obesity is a challenge.
Hey, Rick, I see another question here. That's such a great response to obesity, because I think many of us, struggle with just really understanding I'll just say condition and how you've described it as a chronic disease. So, but this other question sort of segues, if you will. It says, can you talk about statins and how they work and their side effects? And I know often people with obesity, obviously there's other conditions that they're dealing with as well, to include their cholesterol.
Yes.
Could you talk a little bit about that?
I can. Statins are in that group of medications that I talked about. Remember early when I said cardiovascular disease and stroke, we, over the last 40 years, have created lots of different classifications and kinds of medications that help to treat heart disease and prevent heart disease from occurring. And unfortunately, in the human body, if you have dyslipidemia, meaning that the degree of fats in your blood are out of sync with what's considered to be a healthy ratio of saturated and unsaturated fats and triglycerides, those can cause your blood vessels to become rigid and narrow and atherosclerotic, and that can affect your blood pressure, leading you to heart disease, kidney disease, and stroke. So statins are one class of medications that work on how your body metabolizes lipids and uses the lipids, the fats, saturated fats, unsaturated fats, other kinds of fats like triglycerides. And they help to reduce the unhealthy fats, which are sometimes referred to as the LDLs, low density lipoproteins. If you get your lipid panel back, your cholesterol test back, you'll get different tests. One would be your total cholesterol. And we like the total cholesterol to be under 200, right? That's the magic number that's often used. But it's not only the amount of cholesterol that's circulating in your blood, but it's the type of fat that's in your blood. So then there's these ratios of high density lipoproteins, which are considered the good guys, the protective, and the low and very low VLDL, and those are the bad guys. So what the statins do through working chemically on the way that you metabolize fats is that they help your body to have more of the good guys, the HDLs, and reduce the triglycerides, the LDLs, and the VLDLs. And the statin is a great discovery to reduce the chances of having heart attacks or cardiovascular disease. So now the side effects are, I don't want to say they're common, but they're not uncommon. Because of the way that the statins have your body functionally change the metabolic breakdown of fats, sometimes the statins have been known to cause the muscles to get damaged, the muscle in your body. So like anything with good, there's often something that potentially could have an adverse reaction. So people who take statins could sometimes develop muscle pain and cramping, which is a problematic side effect, particularly if you're taking high doses of statin. Now, some people, and this is a very controversial area, and maybe some of you who have seen your nurse practitioner, your physician assistant, or a physician associate now, as they're called, or your physician or your primary care provider may be on a statin preventively. Maybe you don't have high blood pressure, you never had a heart attack, you may or may not be overweight, but there seems to be that that there's some evidence to support going on a low dose statin after you reach the age of 62 or 65, or but that is not a fully recommended treatment. But you can talk to whoever your provider is about it if you're not on a statin and you're, let's say, over the age of 60, and particularly if you have risk factors for cardiovascular disease. Statins provide tremendous benefit. The other thing about statins that is panning out is they're anti-inflammatory. So inflammation is also a bad thing for the human body because it causes cells to do weird things. And when cells do weird things, they can become cancerous. So by reducing inflammation, by taking a statin, you actually may be reducing your chance of developing certain types of cancers that thrive on inflammation, like in the gut, in the bowel. So they have many benefits. It's a good question, though. And
that is great news. And I know at one time there was some, people thought there was some correlation with taking statins and insomnia. But, and I know, this particular slide that you're on, relates to sleep and better sleep. And it'd be wonderful just to hear a little bit more about that.
Well, I think many drugs can interrupt your sleep patterns. Sometimes it might make you somnolent, it might make you sleep more, it might make you fatigued, and some might cause you to be trouble falling asleep. I'd have to look that one up, Janine. I'm not familiar with my patients saying that they have trouble going to sleep, so I don't have a lot of experience on that from a statin.
That's great.
I'm not aware of that, but I'm not saying it's not possible or nor an issue. But you stumped me on that one.
Well, I try, but you are the MP, and it's just, like with a lot of other, I'll call it just folklore in health, just to be able to dispel that and from a professional perspective. So thank you.
Yeah, no, that is really true. There's plenty of evidence on many people, especially women. This is very true in women. They like to have a glass of wine or a couple of glasses of wine thinking that's going to help them sleep better. Mm-hmm. In essence, it doesn't help their full sleep pattern. It may take, because alcohol is a depressant. So it might take away some of your anxiety from drinking the alcohol. But research says that you will not have the same quality sleep, that the quality of the sleep you have will be diminished if you're using it as a medication or a sedative to help you to go to sleep. And this is prevalent in women and men, but research says this is a big problem in women, that they, at the end of the day, there's an exhaustion, there's, stress, there's anxiety, and, they're wound up and they feel like, oh, I'll just have a glass or two of wine. And this is very much supported when you watch TV, right?
Yeah.
People are like, oh, at the end of the workday, people say, oh, I'm going to have a glass of wine because I need to wind down.
Exactly.
It actually has the opposite effect on sleep. Doesn't help you to sleep better with a quality of sleep.
Yes. Thank you. Thanks. Thank you.
All right, so we'll move on. We already talked about stress, right? Stress is a bad thing to the human body. It causes inflammation. We're back to inflammation. We're causing back to damage. We're back to the immune system. We're back to all the bad things that could happen from stress. Stress is the opposite of exercise. I said exercise is a universal prescription. Anything that you do, most likely, if you increase your physical activity and exercise, it's going to improve that. Stress is the antithesis of that. No matter what you have, stress is going to make it worse. It's just a bad mojo. And everything we can do to minimize stress in our lives is going to make us a healthier, happier person. And not everybody, deals with stress the same way. We all have different coping mechanisms. We all have different histories. We have different upbringings, different trauma in our past. And this is complicated. There's no one size fits all in dealing with stress. So, but what we do know is that each of us can find our space and try to really dig deep into what we know about ourselves that could help us to become better at minimizing stress and dealing with challenging moments in our life. One thing that's, become very popular, and I do it all the time, is really just taking time outs and meditating of some sort, having some form of meditation and time out with life, and just relaxing and listening to the world around you and the deep breaths and etc. It really works. There's plenty of evidence, scientific evidence, that says it helps to strengthen your immune system. It helps to reduce your blood pressure, etc. So you can work and make things better for yourself. Don't feel like you fall into a hole and you can't get out of it. I know many times in life we feel like, all right, I dug myself a deep hole here. Am I ever going to get out of this? And then it just keeps resurfacing. You have the power to control that and re-energize your mind. There's lots of psychological literature says that you can convince yourself of anything, and if you reprogram your mind, you can reduce stress. And there's lots out there on that. Second, another area that many of us are dealing with is chronic pain. It's troubling, chronic pain, right? It's always there, gnawing at you, and it disrupts our life. It makes us angry people sometimes. It makes us not nice to be around when we have chronic pain. It makes us look for substances like alcohol, other drugs to help minimize the pain. And the best way to treat chronic pain is to try to not get to chronic pain by treating acute pain before it becomes chronic pain. But in that case, if it doesn't get treated and you can eliminate the pain while it's in the acute phase before it becomes chronic, there are ways, multimodal strategies to help with chronic pain. And obviously, I've already said exercise is a universal prescription for everything. There's lots of data on the fact that getting exercise helps to reduce chronic pain. There are strategies that you can use psychodynamically that can help you to try to alter your pain patterns. You can look at massage therapy, acupuncture, different non-Western traditional, not typically traditional Western medicine types of ways to minimize chronic pain. Try to stay away from opioids because long-term use of opioids can be addicting and they really have no business in treating chronic non-malignant pain. Yes, opioids are very important for treating chronic malignant pain, pain that comes from cancer, because that's just, you have to have it. But in non-malignant pain, Tylenol, Motrin, different other modalities to try to minimize and treat your pain. But you can do it. It's not easy though. I know that. I have chronic pain. The issue with loneliness and sadness, which was well in existence long before the pandemic, but really has brought itself to a new head, a new light during the pandemic. We need to take a grip on that, think about that, and how we can become more social beings and reaching out to community groups, because that will help us in managing our chronic disease. If we have chronic pain and we're not of the mindset, or if we're lonely and don't feel like life is all that valuable and maybe not worth living, we're not going to care about our chronic illness. We're just going to let it go. So all of these are interconnected in how we can move toward a healthier environment. So what can you do? I'll just spend very briefly a few minutes from a prevention side. Make sure you get vaccinated. And I will tell you, I will preach COVID vaccine from here to kingdom come. I do it with my patients. I do it with the public. There's unequivocally no doubt that COVID vaccine reduces your chance of getting seriously ill from getting COVID. But it's just not COVID. It's a lot of other vaccines, pneumococcal vaccine. Make sure you're getting the shingles vaccine, etc., to reduce your chance of getting an illness like shingles, which will become chronic because there are vaccines. Scheduling your colonoscopy after the age of 40, you should be talking about this. Or if you come from a family where there's early colon cancer in the 30s or even late 20s, you might want to get screened. Make sure that you are getting checked for diabetes, also controlling your diabetes and making sure that you're trying to keep your hemoglobin A1C within a normal range or a good range. If you have a uterus, making sure that you are getting pap smears or cervical screening, because HPV, which is a vaccine, by the way, and it's the only anti-cancer vaccine that we have. HPV, certain types of HPV are known to be causative of cervical cancer and penile cancer. So getting your cervical screen, which will be a pap test, looking for HPV will help to determine your risk of getting cervical cancer. If you're sexually active, making sure that you get screened for STDs. Very important. Talk to your primary care provider about that. Don't be shy. Make sure you get your mammogram. Mammograms, maybe they're not perfect, but boy, that's all we have and they do work. And making sure that you are going in at the appropriate time for your mammogram, following up, etc. Getting your blood pressure checked on a regular basis. And if you have high blood pressure, making sure you start doing things about it with your diet, with your physical exercise, getting into healthy habits, and maybe going on medication. And we talked about cholesterol, keeping your cholesterol down to the normal range or getting it into the best range that you're capable of based on your biology. Paying attention, women have much more of a problem with this than men, postmenopausal, especially with bone health, making sure that you are paying attention to your bone health by making sure you get enough calcium in your diet, but also doing exercises that are resistant exercises, meaning doing things where you're pushing against something or pulling against something. Walking, pounding the pavement is one example. Swimming is a great exercise, and bicycling is a great exercise, but they don't provide the kind of protection against osteoporosis than other exercises do. So a combination of those. And checking yourself, or if you have a partner or a spouse or a live-in, checking yourself and making sure when you go to your primary care provider that you get your skin checked for early skin cancer. And particularly if it's a lesion that is changing rapidly, or it is looking funky in its color, like the one on the right, which is the melanoma, you should go in and get checked. So that's the prevention. And I'm getting ready to close and see if there's any other questions. I came across this from a friend, and I thought I would share this with you. I love this poster. It says, "I love the woman I've become because I fought to become her." And having a chronic illness is a battle. And you are empowered. You have the power. Just as Janine said, you have the power. You can control your disease. Don't let your disease control you. You can do it. There are methods. There are preventative tools you can use. There are medications that you can use. There's diet that you can use. There's exercise that you can do. Once you start controlling your disease, you feel empowered and you feel free. Like it doesn't control you anymore. So it can be done. It's work. And what's that saying? Anything that's valuable requires work. But it's proud work. When you do it, you're proud of it and you feel good about yourself, etc. So that's me, and I thank you all, and I thank you all for inviting me, and I look forward to your questions. I'm going to stop sharing the screen.
Rick, that was just absolutely phenomenal and comprehensive. I mean, sometimes we view, chronic conditions. I like the way you started out. You talked about but how much is going right with us? And in order to stay on that sort of right trajectory, if you will, there's so many things that we can do, that we have control of, that can enhance our health outcomes. We just can't thank you enough for this incredible presentation. It's been a joy to spend time with you. And I'm looking at the questions. I think we've answered, I think you have answered the majority of these.
I have one question.
Thank you.
Can I be heard?
Celestine.
Yeah. Okay. Thank you, Dr. Ricciardi. First, I want to say thank you for your service, your military services. Happy Veterans Day. And the second thing I want to ask, can you speak on pre-diabetes? When I get my test, I always say it's pre-diabetic, can you speak on that a little bit?
I can, and I'm glad you brought that up, because I actually had a patient yesterday in clinic who was pre-diabetic, which means that you're at risk for diabetes. For example, like if you're one of the tests we use is hemoglobin A1C, which is glycosylated hemoglobin. And what that does is it tells you how much variability there is in the amount of glucose that's floating around in your blood. But like I said, your body likes to keep your glucose between 80 and 100 circulating in your blood. And if it goes up a little bit, like it may go up to 110 or 115, but not up to 125 or 130, which is in the diabetic range, but it's classified diabetes. And if your hemoglobin A1C might be like 5.9 or 6.0, it's not in the full diabetic range, but you're heading that way. So let's say you have a heavy meal and your kidneys and your body isn't keeping your blood glucose under 100, and it might go up to 120 or 130, and it stays there for longer than it should. So that's the pre-diabetic state. It's when you are inching your way toward full-blown diabetes, and that is the warning sign that you need to act. That's the best time to act. First of all, you're lucky one to know that you're in prediabetes, because that should signal to you, I better do something. I better get on the ball here. I better start exercising and watch my diet and maybe lose a little bit of weight if that's something you need to do. Because otherwise, I'm going to end up getting diabetes, et cetera. So I like to consider prediabetes as your warning that you need to do something. Because if you don't, because of the aging process, you will, and if nothing changes, if your diet doesn't change, your weight doesn't change, you will go on to have, and your physical activity doesn't change, you will go on to have diabetes. Does that answer your question?
Yes, thank you so much, doctor.
Thank you.
Anybody else?
Anyone else?
I think I went over. I got so excited about talking that I went over the time.
No, we got excited as well because we have quite a few people still remain on the call. Are there any additional questions? If so, open your mic and and let Rick Ricciardi hear from you. Okay, well, hearing none.
It was wonderful. Thank you so much. It was wonderful.
Well, thank
Yeah,
you
so much
all.
good
And I
information.
really enjoyed being with you, and I wish you good health.
And thank you to everyone who attended the session today. Please visit iawh.org to sign up for our newsletter so that you don't miss announcements of upcoming events like this. And also ways that perhaps you can volunteer with IAWH. That would be awesome. The December Lunch and Learn will focus on the importance of sleep as
That's great.
I knew you would say that. Sleep and the impact that the proper amount of sleep can
Okay,
have.
so here's the question to the group. Why is sleep important?
Does anyone want to take a
Our
gander?
body gets to regenerate itself.
There
For the
you go.
immune
All
system?
right. And the immune
Okay.
system
Right.
is smiling, right? Remember, the immune system smiles when you sleep.
I
So
love
you
that.
all should attend that session on sleep, because sleep is so important.
It sure is. And I love the idea of naps. So
Yeah.
see, Rick, you have a number of thank yous, how informative the session is. Great session, outstanding session, and I will only kudo.
Oh, well, thank you all.
And ditto. Thank you.
Yeah, you all stay well, be well, and protect yourself from COVID. Make sure you get vaccinated.
Thank you.
All right, bye.
Have a good afternoon, and thank you again, Rick.
My pleasure. Bye.
Talk to you soon. Bye.